What's in your head is just as important as what's on your plate.
You get to be in control of how other people show up in your life.
It is pretty easy if you're prepared, and I think being prepared is the key.
Hi everyone, thanks for being here and joining us today. My name is Ian Patton. I'm the Director of Advocacy and Public Engagement for Obesity Canada, and I'm joined by Mary Forhan, so I'll let her introduce herself as well.
Thanks, Ian. It's a pleasure to be here with you today, and thank you, WW, for inviting us to share all about Obesity Canada. I'm Dr. Mary Forhan. I'm the current Scientific Director of Obesity Canada. So who is Obesity Canada? We've been around for 16 years. We were formerly known as the Canadian Obesity Network, and it is currently Obesity Canada is Canada's largest national obesity charity for Canadians living with obesity, for health professionals, researchers, trainees, and students and policymakers. Our vision and mission has grown over the last several years, and currently our vision includes a day when people affected by the disease of obesity are understood, respected, and living healthy lives. Our mission is to improve the lives of Canadians through obesity research, education, and advocacy. And I'll add here that we don't do any of this alone. We do this with individuals living with obesity as partners. And you'll hear more about that from Ian later on in the presentation. So our 2020-2025 strategic objectives include research, education, and advocacy. And you can see in each of these columns where some of our focus areas are. In terms of research, we want to support, build, and nurture our research network. And we want to identify and communicate gaps in knowledge about obesity, obesity treatment, and obesity areas of research that we can expand on to promote health and well-being. In terms of education, we want to amplify the knowledge exchange and engage in knowledge translation. So getting that research knowledge out into action to actually have an impact on the health of Canadians, and to develop a plan to eliminate stigma. And in terms of advocacy, this is an area that is just growing enormously within Obesity Canada. And again, you'll hear more from my colleague Ian about some of the great work being done. But in terms of advocacy, we want to create a movement by building our local membership, by shaping and informing public policy, and in terms legally, medically, and socially define obesity as a disease. So we published a report card a few years ago, and it was really a report on access to obesity treatment for adults in Canada. And this report card was published in 2019. There's been a few changes, a little bit more options in terms of treatment since then, but we do have a long way to go. And what we're finding pardon me, we've skipped a couple of steps here. Another activity we've done to really help organize and focus evidence-based treatment for individuals living with obesity was we revised and published in 2020 the Canadian practice guidelines for adult obesity. This is a seminal piece of work that's happened out of Obesity Canada, and it was published in 2020. And what this guideline does is it's about obesity in adults. And it's a clinical practice guideline that was put together through collaborations with individuals living with obesity, with scientists, with physicians, with nurses, with occupational therapists and dietitians, sort of a whole host of individuals working toward effective treatment and management of obesity. In terms of research, we have an impact of, oh, I'm sorry, this is a cover. Pardon me, I'm reading as if this was our guidelines, but what this actually is the cover of the CMA journal, which is where an executive summary of the guidelines was published. And this executive summary was actually the 25 most read articles from 2020, which actually is remarkable for a couple of reasons. One is that usually obesity research and treatment doesn't get that level of profile. And to have that level of profile in Canada's leading medical journals is really important to us, because that means that it's being used and taken up by individuals who actually have the opportunities to empower and impact change in obesity treatment. The other reason this is remarkable at this particular time is that you can see from the other articles that were included in this journal, we're very much focused on COVID. So for obesity treatment to be one of the top 25 most read articles in Canadian Medical Journal during a time of a pandemic, we feel is a real success and demonstrates the need for this information and the readiness for our medical community to want to learn more about obesity. The other areas that we focus in on are weight bias, weight stigma, and weight-based discrimination. So when we talk about weight bias, this is becoming more and more awareness around what weight bias is it's really those negative personal attitudes and views about obesity, and then about individuals living with obesity. That then translates into weight stigma, which is the labeling of people living with obesity based on a deeply rooted social stereotypes and making assumptions about obesity in terms of what their skills are, what their opportunities are, who they are as an individual. And then weight-based discrimination is when we treat people with obesity differently or unfairly, simply based on their body weight. And there's verbal, physical, and relational discrimination associated with that. So Obesity Canada really takes this quite seriously. And as you saw in the pillars of some of our key objectives, this is equally important to research and advocacy. So I've been using the word obesity a lot so far, and we want to really destigmatize and make this word more comfortable, and we want to define that in the context of a chronic disease. So obesity previously has only ever been defined by BMI. BMI is a measure of body size. It's not a measure of health. So someone can have a larger or a higher BMI, but be perfectly healthy. So we don't want to use BMI as the sole measure. And so it's high time to move away from weight-centric definitions and focus on health. So in that spirit, obesity is defined as a prevalent, complex, progressive, and relapsing chronic disease that is characterized by abnormal or excessive body fat or adiposity that impairs health. We've underlined impairs health. People can live in what might be defined as a large body, but not have the disease of obesity. And so that's really important to get medical advice and a medical diagnosis on if an individual is really living with the disease of obesity, because it's the disease of obesity that Obesity Canada is referring to in terms of treatment. We are not about treating large bodies. We are about treating the disease of obesity. So when we talk about other defined parameters around obesity, BMI and waist circumference can be used as screening tools that might be associated with higher risk of health conditions or weight-related health concerns. The diagnosis of obesity should be based on the presence of functional, medical, and/or psychosocial impairments related to the presence of abnormal or excessive body fat, rather than on anthropometric measures or BMI alone. So key principles of obesity management that are outlined in the guidelines is that obesity really should be managed using evidence-based chronic disease management principles, okay, and must be personalized. And that means really taking and validating that patient's lived experience, move beyond simplistic recommendations about eating less and moving more, and address the root drivers of obesity. People who are living with obesity should have access to evidence-informed interventions, which should include medical nutrition therapy, physical activity, psychological interventions, pharmacotherapy, and/or surgery. So it's a comprehensive approach, and it's not a one-size-fits-all when it comes to finding the best fit for a patient for the treatment and management of obesity. So what do we do in terms of weight bias? So recognizing and addressing weight bias. So people living with obesity face substantial weight bias and stigma, which directly impacts their own health and well-being, as well as impacting their access to care. So what we are trying to do with Obesity Canada, I think we've been making some really great strides in this area, is encouraging healthcare professionals to assess their own beliefs and attitudes towards people living with obesity and how that might actually influence the care that they provide their patients. So we do a lot of work and reflective activities with healthcare providers to acknowledge where weight bias might be and start to take action to address that. Healthcare providers need to be aware that internalized weight bias can adversely affect the behavioral and health outcomes of their patients. And healthcare providers should avoid using judgmental words. So when working with patients living with obesity, you're going to see the language I'm using is patients living with obesity. And we've adopted that from the chronic disease literature and practices that defines a person first and does not define a person by their disease. And we recommend that healthcare providers avoid making assumptions that an ailment or a complaint of a patient presents with is related to their body weight. Not every health concern that a patient comes to an office with is actually related to their weight. And we really encourage healthcare providers to move beyond blaming or using weight as an explanatory factor for why somebody might be having some other issues in their health. So Ian, I'm going to pass it over to you.
Thanks for that, Mary. And so just to, as I mentioned earlier, I'm the Director of Advocacy and Public Engagement for Obesity Canada. And part of my role is to do a lot of the public facing, our initiatives that are public facing, as well as the patient advocacy side of things for Obesity Canada. I have a PhD in kinesiology, and my research actually focused in on physical activity and obesity. But I also have a lived experience myself. So I was someone who grew up as, the bigger kid in school, and I was teased when I was younger. And as I moved into my adult years, I actually got pretty sick with the disease. And I want to reiterate that when I'm using the word obesity and I'm talking about it as a chronic disease, the definition that Mary highlighted there, where I'm not talking about size or weight, but I'm talking about when excess or abnormal fat mass impairs health. And so personally, I got to the point where I was really quite sick and I was worried about my health. And I had to go and seek out some professional help, some health professionals to kind of support me in managing this disease. I've since learned a great deal about the science of obesity, why some people have a hard time managing obesity. A lot of the different factors like genetics, our brain and how that is involved in it, our environment, and even our own biology, and how those are not controllable by our behaviors, but definitely have an impact on our obesity and how we can manage it. So it can make it really quite difficult for some people. So I ended up going through, and I continue to go through obesity treatments and manage my disease. And through my work speaking with others, I also learned that I wasn't alone in my experiences. And there was a lot of other people that had very similar experiences in healthcare, in the public, and in their workspaces and stuff like that. And so we have this community, OC Connect, where we have people living with obesity that kind of can get together and support each other. And I asked them what it was like in one word, try and describe in one word what it is like living with obesity. And the words that you're seeing on the screen right now are the words that were used. So you can see that living with obesity for many people is something that has a lot of stigma and shame tied to it. And that's something that Obesity Canada is working really hard to change. And a lot of that starts with speaking about obesity differently and trying to raise awareness about what we know. So we can move to the next slide here. Sorry. So one of the ways that we do this, and we try and change the narrative or kind of share the information about obesity as a chronic disease, is through this community, OC Connect. This is our kind of flagship public facing tool. And it is a private, moderated online community where individuals living with obesity can find peer support, evidence-based education, and empowerment. It's something that launched around the same time that we published the clinical practice guidelines last year. It continues to grow and evolve, and it's something that we're very proud of. So we'd welcome you to come and join us and check it out if you'd like. And so, like I said, this is one of our main ways of connecting and sharing the information that we have. We can go to the next slide as well. We also, another way that we try and change the narrative about obesity is we have an annual public conference. It actually just took place last week. So the Connected Conference is one of the things that we do every year, where we try and bring together some of the top experts in the country that are working in the field of obesity management, and we try and connect them with the people who are living with the disease and need to learn about that information. So it's a great opportunity to learn from and engage with some of the top experts in the world, but we also put a heavy focus on highlighting lived experiences and patient advocates, and having the voices of people living with obesity being kind of a central focus there as well. We've been virtual for the last 2 years with our Connected Conference because of the pandemic, and looks like we're going to continue to be virtual next year. But we are looking forward to the time when we can have these as live in-person events as well. So check that out if you can, and we can move on to the next slide. Another tool that we have is these connected conversations. These are our regular webinar series that we have going on. And this is an opportunity for us to have deeper conversations about some important topics. I find a lot of times with some of the information that we're sharing, or presentations that we produce, it can be, the conversations don't go deep enough. They don't kind of get into the important parts of the conversations. And so with the Connected Conversations webinar series, we were hoping to have more depth to the conversations, where we're talking with experts about very specific issues that are very important to people living with obesity. So things like diet culture and weight bias and advocating for care. And so these are some of the conversations that we're having with people who are working in this area. And so again, like most of our content that we have for the public, it's free to join and free to register. You can check out the link there at the bottom of the slide, and you can also find the recordings of previous webinars there as well. And we can move to the next slide. And Mary talked about advocacy and some of the work we've been doing with advocacy. This is something that Obesity Canada has kind of shifted towards over the last couple of years, and it's become a major part of what we do. In my role and the patient advocacy side of things, we're working to try and empower individuals living with obesity by giving them the information and the tools that they need to be able to speak up, share their experiences, ask for help when they need to, and those sorts of things. So the infographic on the right side of the screen here about talking about obesity, this is something that came out of our clinical practice guideline project. And it's just a simple conversation starter, a tool that someone could print off and take to their doctor and maybe inform them that there are these new clinical practice guidelines, evidence-based treatments and management tools that are available. And it is an easy way to start that conversation. So these are just some examples of the advocacy work that we're doing, or the tools that we create. We also have a lot of other infographics and explainer videos and other ways that you can access information about obesity. As a patient advocate, this is something that I am very, very passionate about. I think one of the big things that we have to do is reduce weight bias and stigma, and I think that is the first step in getting to a national obesity strategy, which is something that Obesity Canada is hoping to achieve in the next 5 or so years. So we need to talk differently about obesity. We need to understand it better and make it more comfortable to be able to speak up and use the information that we know about. And so we can flip to the last slide here, and There we go. The last slide here is just a link to the clinical practice guidelines that Mary mentioned. These are very comprehensive. There's lots of information there. You can check them out if you want to. There's also the summary article and all the information that goes along with that. They're just really great tools to be able to understand obesity a bit better and understand what the recommendations are for obesity management. And so with that, I'm done with my part. I'm not sure if we have anything else, but I do want to thank you all for giving us some time to talk about this and share the work that we're doing.
Great. Thank you so much, Ian. And again, thank you to WW for the opportunity. And as Ian said, please don't hesitate to reach out. You can go onto our website, and it's easy to find us on that website. And again, I'm Mary Forhan, the Scientific Director of Obesity Canada, and I'll pass it over to Ian to sign off.
Yeah. So thanks again for having us.